Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the locking and unlocking mechanism of the knee joint. A knee joint is locked when it is fully extended with medial rotation of the femoral condyle on the tibial plateau in the later part of the extension. So for complete extension of the knee joint, we need medial rotation of the femur over the tibia in the last part of the extension. Idea is that the anteroposterior diameter of the lateral condyle of the femur is smaller than that of the medial condyle of the femur. So when in the process of extension, the lateral condyle is taken up, but still a part of the medial condyle is not used up, so that it is used by medial rotation at the later part of the extension process. Okay, so what happened in case of full extension? Articular surface of the femur and the tibia are in maximal contact here. Articular surface of the femur and tibia are in maximum contact. Okay, and there will be medial rotation of the femur over the tibia. Okay, we got that. So there will be medial rotation of the femur over the tibia. All the ligaments are taut, and these all ligaments maintain the stability of the knee joint. And knee joint in full extension is the most stable condition. Okay, and this stability is maintained by the cruciate ligament, anterior cruciate ligament, posterior cruciate ligament, tibial collateral ligament, fibular collateral ligament, and the fibrous capsule of the knee joint, and also the iliotibial tract. So all these ligaments are taut, and all of them are essential for the maintenance of the stability. This is the flexed condition. There is minimum contact between the articular surface of the femur to the tibia. This is the process of extension. This is full extension. In the later part, the full extension process, there is medial rotation of the femur over the tibia, and this is the extended position. This is now locked condition. This is locked, so it will help to reduce the tension or pressure on the muscle above and below, because knee is locked now. So that is the locking mechanism. Unlocking mechanism is done by the popliteus muscle. This is the popliteus muscle, the lateral condyle of the femur going to the popliteal surface of the tibia, and this is the popliteus muscle. This muscle initiate unlocking of the knee joint. So for extension, we have the medial rotation happen in the later part of the extension process. So medial rotation is a part of extension, and here the popliteus actually unlock the knee joint, and it is done the initial part of the flexion process. Okay, so if you go there to the locking mechanism here, okay, so what happened? Medial rotation of the femur on tibia tightens the ligament, and flat surface of femoral condyle is in contact with the tibia and stabilizes the joint. Here maximum contact between the articular surface of the femur to that of the tibia. Line of center of gravity is anterior to the knee joint here. This line of center of gravity, and maintains extension. So locking mechanism of knee joint, the anterior cruciate ligament is taut and prohibit further extension. Locked knee act as solid columns adapted for weight bearing. And we must remember that maximum extension happen when there is maximum extension of the hip joint. then we'll get maximum extension of the knee joint. The knee joint is locked in its most stable position. This is the most stable position. The foot is on the flat surface, and this is the most stable condition. The articular surfaces are in close contact for the maximum part of the articular surface is taken up in the extension process. Primary muscles of extension are the quadriceps muscle, like that of the rectus femoris, vastus lateralis, vastus intermedius, vastus medialis. And vastus medialis a very important role along with other muscles of component of quadriceps femoris for the locking mechanism, because insertion of the vastus medialis is further down along the medial border of the patella. Okay. Secondary extensor, weak extensor are tensor of fascia lata. Okay. So quadriceps muscle innervated by the femoral nerve. Okay. Tensor of fascia lata innervated by the superior gluteal nerve. Okay. We got that. Unlocking of the mechanism of the knee joint. What happened in unlocking mechanism? To unlock the knee joint, Popliteus contracts, rotating the femur laterally about 5 degrees on the tibial plateau so that flexion of the knee can occur. Popliteus is the muscle that unlocks knee joint. Remember, at the beginning of flexion of the fully extended knee. But medial rotation in extension happen in the later part of the extension process. Here, unlocking mechanism start from the very beginning by the popliteus. Popliteus is important muscle for the unlocking mechanism and stability of the knee joint. So what are the actions of popliteus? Stabilizes knee joint, resist lateral rotation of tibia on femur, unlock the knee joint, laterally rotate femur on fixed tibia. These are the actions of the popliteus. Popliteus is innervated by the tibial nerve. Okay, primary flexors of the knee joint are hamstring muscle and short head of biceps femoris, like that of the semimembranosus, semitendinosus muscle, long head of biceps femoris muscle, hamstring muscle, plus short head of biceps femoris. Hamstring muscle are innervated by the tibial part of sciatic nerve. Short biceps femoris muscle, short head, is innervated by the common fibular part of the sciatic nerve. Secondary weak flexors are the gracilis. Gracilis is an adductor muscle innervated by the obturator nerve. Sartorius, front muscle, and cross the thigh on the anterior aspect. That is the sartorius, nerve supply femoral nerve. Gastrocnemius, okay, that also are flexors of the knee joint innervated by the tibial nerve. Popliteus innervated by the tibial nerve. Okay, so we got the locking means full extension. Unlocking means begins to flex. Okay, full extension is the main purpose that is done by the quadriceps femoris muscle, and it maintains all ligament taut, and the knee joint is most stabilized. Unlocking, it is not medial rotation of the femur, it is lateral rotation, and it is initiated by the popliteus muscle. And that's all about the locking and unlocking mechanism of the knee joint. So if you like my video, please support my channel. If you have any question, please feel free to ask me. Please share the information with your friends, and please support my channel. Please subscribe me. Have a nice day. Bye now.